A very common question in the comments and in private messages from patients, which we sometimes forget or rush through in appointments and patients don't ask about, is male intimate hair removal. What are the precautions and best methods for doing it? Stay with me till the end to clear up this common question. Men are increasingly seeking male hair removal for aesthetics or to make hygiene easier, which isn't really necessary, as just trimming genital hair is enough for proper hygiene. But male hair removal can cause mild issues, unlike female hair removal. This is because male and female genital skin is very different. First, men sweat up to 25% more than women. Secondly, blood flow in the male genital area is up to 50% higher than in females. The pH of male genitalia is more acidic. Also, male pubic hair is thicker and the skin is rougher. As a result, female hair removal is more acceptable, conceivable, and easier than male hair removal. Therefore, special care must be taken when removing hair from the male genital area. Now, regarding terminology, we often say hair removal, but there's a difference between depilation and epilation. Epilation removes the hair follicle from its root, from its base. It's a deeper process, including methods like tweezing, laser, and waxing. Depilation, however, involves cutting the hair midway and not removing it from the root. These are less painful methods like depilatory creams, razors, or blades. But what are the main risks and complications of male hair removal? As I mentioned earlier, folks, the genital area is warm and moist. It's an ideal environment for pathogens, germs, and bacteria to thrive, especially since men have their own microbiota on the skin in that region. Any process that causes injury, scarification, or abrasion can help these germs spread and penetrate deeper skin layers. This can happen during or after hair removal. Among the main complications we observe are superficial and deep folliculitis, which are usually self-limiting conditions. Folliculitis, inflammation, hidradenitis, which is sebaceous gland blockage near the hair follicle, secretion buildup, which is more painful, abscesses, which can be deeper and may sometimes require drainage. Cellulitis, which is skin inflammation in this area, sometimes requires antibiotic treatment along with local care. And finally, more extreme cases such as Fournier's syndrome or Fournier's gangrene. This condition is fortunately very rare, but extremely severe and serious. Fournier's gangrene or necrotizing fasciitis typically starts with superficial inflammation of the dermis, skin, and genital area, which then spreads to deeper layers, rapidly affecting the man's perineal region, forming abscesses. It's an extremely urgent condition requiring immediate medical intervention with broad-spectrum antibiotics to fight the infection. This is an extreme case, folks, but sadly it can be a complication of poorly done genital hair removal. As I mentioned, most complications aren't serious, but how do we do this properly? What's the best approach? The best way is to remove genital hair gently without damaging the skin's protective barrier. For this, men can use trimmers. Trimmers cut hair without directly harming the skin. They're less invasive, painless, and can be used weekly or every other day. Patients often ask if there are absolute contraindications for more invasive hair removal methods. Folks, each case needs individual assessment and a physical exam. Patients with genital warts or lesions should avoid it, as these can spread. Immunosuppressed patients, like diabetics or those with chronic immune system disorders, need to be cautious, as the genital area can be a source of infection, and sometimes, as I said, it can be serious. Did you find this video content important? Do you think it'll help? Share this info, spread the word, subscribe, and turn on notifications for our weekly content. Take care and see you next time.